Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center at Mount Pleasant, Texas, and today's Monday. Sorry, it's Wednesday. I've messed up. I had my slides messed up, so I have messed it up. So today's Wednesday, February 24th, 2021. And I guess that this is going to be the whole message of today is, you know, with the things that are happening around us, you know, we're kind of just, I was just sitting here prior to this episode just saying for the first time that I've seen the continued drop, and we finally can feel it. So I apologize for the start off, and we'll see if we can do better for the next couple of minutes and get going. But from a Titus perspective, and yes, my mom's watching and saw me really screw up. But for the record, that's not the first time that my mother has seen me screw up in my 52 plus years. So I told you so. I'll hear when I talk to her this afternoon. But from a numbers perspective, the good thing is we're continuing to see the trends. Now, with that said, Titus still sitting about that 13 to 14. Today we have 14 COVID patients in the hospital, 6 in the ICU and 8 on the floor. Our remdesivir usage, which I use as tracking, their sicker patients, picked up a little for the last couple of days, but we're staying in that 14 range. As we have a few patients come back in, a few patients have left. As you can see from a regional perspective, though, it continues to drop. And from a region F perspective, this is COVID patients as a percentage of total patients. As you can see, over the last 7 days through Monday night, it continues to drop. And 8.93 is where we ended up on Monday night. Same thing in the Tyler region. They're sitting at 8.62, which is less than us. And you can see continually those 7 days are going down. And then even when you look at the Dallas to our west and the Metroplex area, sitting at 11.31, their lowest as it continues to drop. So COVID as a percentage of the total hospitals across the region continue to drop. When you look at the number of beds, this was a really welcome change that I saw this week. And this is as of today. So these are the numbers that went in as of last night. We're down 89 total patients in the region. And you can see over the last 4 to 5 days, it consistently go from 126 to 89. And for all our people who have been following us every update, as you know, that was one of my concerns, is our region hasn't dropped to the extent that other regions have. We saw it in the last 5 or 6 days. So you can see that hitting at 89, going down 5 to 10 patients on a daily basis. And the same thing with the ICU. 50 down to 35 as the last night is a very welcome change for the Northeast Texas region. And you can see Tyler, and we'll see in a minute in the Dallas, the ICU and the beds continue to go down, not as dramatic as ours have gone down in this region, but they've seen this drop over the last 2 or 3 weeks at a higher percentage than Northeast Texas area. So it was good to see. And here's the Dallas range. You can see it continue to go down. ICU beds leveling off at that 450, 468 area as well. So from a numbers perspective, a good thing. But from a Titus perspective and TRMC, when you look at it, our numbers are still at that 14, 15. So when we look at our total census between 50 and 60 on a daily basis, we haven't changed from that 12 to 16 range over the last week. So what does that mean? It means COVID's still here. It also means COVID's not going away. And I continue to encourage us all to wear a mask wherever we go, to wash our hands, to social distance. And I know it's tough, and it's fixing to get real tough as the spring gets here and we get through the winter storms that we had last week. We all want to be outside. We all want to go out with our friends. We still need to be cautious and careful. We are seeing sick patients still come in. And I don't want to be negative Nancy or Debbie Downer or any other name you want to give me, but I do want to encourage you that it's still real and we still have people who are suffering. So how do we continue in the ray of hope and the sunshine and those things? Vaccine. And the vaccine, we will in the next few minutes receive our doses completely that we were expecting. So you'll start getting texts and stuff. The people who are supposed to have the second dose will start getting those texts this afternoon. Quite a few people already started getting them this morning on the second dose, and you should get your appointment. And if not, you'll be getting a phone call today or tomorrow as well to know what time to come. But we are playing that second dose vaccines, and we will have it. We are going to get a few first dose this week. So we'll be working with the different people, especially people age 65 and over, to get those first doses out this week. So we were notified by the state that we're not a hub, and I was disappointed in that. And we worked closely with the state of Texas to try and get more vaccines here. I think we've done everything we possibly can to show the state that we can give the vaccines out. We have one of the most organized systems for doing it, but we have to play with what we've got. With that said, the state has been giving us 200 to 300 to 400 every week, even though we're not a hub. And I have let the state know we truly appreciate that, encourage every vaccine they'll give us, we will get it in the hands of the right people. So please continue to go to our website, log your name in there. We'll be looking at how we track those names. Without being a hub, it's hard. We're going to encourage people to get on as many websites as possible. So for our people that are out there have been waiting and been patient with us, guys, we can only give what we receive. So I would encourage you to look for some of the areas around us and make sure you're on their websites as well. And anytime we know of the available vaccines, we're letting the public know and getting it out there. So as we finished the COVID updates and we go from there, I want to talk about tomorrow night. We are excited. February is Cardiovascular Month. And with the winter storm this month, we kind of lost our focus on Heart Month and some different things last week with so much cold in the air. But tomorrow night we have a town hall at 5:30. Would encourage you to join us. We're excited to have these three physicians join us and learn knowledge from them. We talk about wisdom, and I talk about wise men. All three of these physicians in my book are very wise, and I enjoy sitting at the table and being in meetings with the three of them and just listen to them collaborate with each other, collaborate with other physicians, and brainstorm. So please join us tomorrow night at 5:30, February 25th, as we have our virtual town hall with them. From a COVID perspective, we hope this continues to decrease. However, it's going to stay here. So from a Titus regional perspective, we are going to have one more update on Friday, and then we'll go to weekly updates. And again, those weekly updates will be focusing on the health system. We'll continue to get vaccine information out there. We'll continue to give more infectious disease as different strains come in. One of the things we're going to focus our time on is trying to put together more of these virtual town halls and opportunities for you in the community, you in Northeast Texas, to reach out to our different physicians and other services, not just the physicians, but some of the clinical services as well. One of the questions we just received is the COVID-19 vaccine available. We have received a few first doses this week. Those have already been allotted to people on our waiting list who are over the age of 65, and we'll be contacting those people. So as far as having additional doses available just to give to anybody who shows up, we do not have that. We're going to get 200 this week, hopefully 400 next week is what we're being told. But we'll continue to work with the state of Texas. We'll continue to push to make sure the state knows that Mount Pleasant, Texas, and Titus County, Northeast Texas, is a special place, and we need that vaccine here. And just don't forget about us on a daily basis. And we'll beat the drum and make sure we're singing from the mountaintop of how great it is to be here, and our people need it. Again, I appreciate the support not only of our employees, of myself, but we truly appreciate this community supporting this health system. Talk to you on Friday. God bless.